Good day, everyone. In today's increasingly diverse healthcare environment, providing quality nursing care requires more than a clinical knowledge and the technical skills. It also demands cultural understanding, respect, and compassion. So we are the Group 3, and today we will be presenting our journal. This is entitled Challenges and Approaches to Transcultural Care, an integrative review of nurses and nursing students' experiences. Join Joining me in today's presentation are Ms. Harid Atia, Ms. Hako Denisani Rose, Ms. Ko Andrea Cleo, Mr. Linaw Ian Fritz, Mr. Makasuhay Leonardo, Mr. Magalaman Richan, Ms. Magdaluyo Vinville, Ms. Malabuyok Nicole, Ms. Mansera Jasmine Fritz, and Ms. Masandag Nasima. Together, we will discuss the key findings of the study, its implications for nursing practice, and key transcultural competence has become an essential component of delivering safe, respectful, and high-quality healthcare. Without further ado, let us begin our journal discussion. For our objectives, at the end of the presentation, the audience will be able to identify the common challenges encountered in providing transcultural nursing care, explain the key approaches to delivering effective transcultural care, apply the principles of transcultural care in providing culturally sensitive nursing interventions, analyze the role of education and interdisciplinary collaboration in enhancing the transcultural nursing practice, and lastly, to evaluate the importance of cultural competence in promoting safe, equitable, and patient-centered nursing care.
So for the introduction, transcultural care is an essential aspect of nursing as patients come from diverse cultural, ethnic, and linguistic backgrounds. Nurses must provide culturally competent, patient-centered care by respecting patients' beliefs, values, and healthcare practices. This presentation explores the challenges, approaches, and significance of transcultural care in nursing. So in today's healthcare setting, nurses care for patients from how many different cultures. So each patient has unique beliefs, traditions, and languages, and values that influence how they perceive illness and make health decisions and respond to treatment. So as nurses, it is our responsibility to respect these differences and provide care that is culturally appropriate without discrimination. So by practicing transcultural nursing, we can improve communication, strengthen the nurse-patient relationship, increase the patient satisfaction, and ultimately achieve better health outcomes. So today we will discuss the importance of transcultural care, the challenges nurses may encounter, and the strategies for providing culturally competent nursing care.
So, for the background of this journal, increasing cultural diversity among patient population has made transcultural nursing more important than ever. However, nurses and nursing students continue to face challenges such as language barriers, cultural differences, limited cultural knowledge, and inadequate organizational support. These challenges can affect communication, clinical decision making, and the quality of patient care, highlighting the need for effective transcultural nursing practices.
So, for the key findings, language and communication barriers were the most common challenges in providing transcultural care. Second is the cultural differences, personal biases, and stereotypes affected nurse patient communication and relationships. Third is the limited cultural competence. Training and organizational support reduce nurses' confidence in delivering culturally sensitive care. And fourth, self awareness, respect for cultural differences, and effective communication promoted effective transcultural nursing care. And lastly, the collaboration with patient, families, interpreters, and the healthcare team strengthen patient centered and cultural competent care.
The findings of this review have several important implications for nursing practice. So first is respect patients' cultural beliefs, values, and traditions in all aspects of care. Next is enhance communication skills to build trust and provide patient-centered care. Next is strengthen cultural competence through continuous education, training, and clinical experiences. Collaborate with patients, families, interpreters, and the healthcare team to deliver culturally appropriate care. And lastly, practice empathy, teamwork, and evidence-based nursing to provide safe, culturally sensitive care.
For conclusion, this study emphasizes that effective nursing care extends beyond addressing physical health needs and includes understanding each patient's cultural beliefs and values. Cultural competence, empathy, self awareness, and effective communication are essential in building trust and improving patient outcomes. Strengthening transcultural nursing through education, collaboration, and organizational support enables nurses to provide respectful, inclusive, and high quality patient centered care. That's all. Thank you.
So, as nurses, we should continue developing cultural competence through education, collaboration, and self-awareness. By doing so, we can provide respectful, inclusive, and patient-centered care while building stronger relationships with our patients and improving their overall health outcomes.
Virtual hand. Please state your question, Miss Ko.
Yung question ko lang po is, what are the common challenges that nurses face when providing transcultural care po?
So, the common challenges nurses face are language barriers, cultural differences, communication problems, personal biases, lack of cultural knowledge and training, and limited organizational support po.
Go on, Miss Nicole.
My question po is, why is transcultural care important in nursing?
So, transcultural care is important in nursing because it helps nurses provide a respectful, patient-centered, and high-quality care while yung considering the patient's cultural beliefs, values, and preferences po.
Does that
Um,
answer your question, Miss Malabuyo?
yes po, pero ang follow-up question ko lang po is, how can nurses improve their ability to provide transcultural care?
So for that question, so nurses can practice self-awareness, respect cultural differences, and improve communication skills, and learn about different cultures and collaborate with patients, families, and interpreters and other healthcare providers or healthcare professionals.
Okay po. So ang question ko po is, what should nurses do when they encounter cultural differences or personal biases po?
So to answer your question, Ms. Nasimam Sandag, nurses should recognize and reflect on their own biases, avoid stereotyping, respect differences, and remain open-minded when caring for patients from different cultures.
Does that answer your question, Miss Nasima?
Yes po. Thank you po.
Okay. So, one last question. Okay, Miss Jasmine Fritz, please state your question.
So, my last question po. What is one important lesson from the article for future nurses po?
So for that question, Good nursing care is not only about performing procedures correctly, but also about respecting patients' cultures and beliefs. Effective communication, empathy, open mindedness, and teamwork are essentials for culturally sensitive care. Thank you.
So once again, thank you for your time, attention, and participation. We hope our presentation has provided valuable insights into the importance of transcultural care in nursing practice. Have a great day, everyone.